Pemetrexed combined with cisplatin or carboplatin has been the standard chemotherapy regimen for mesothelioma for over 20 years. If you're starting chemotherapy, this is likely what you'll receive, either alone or combined with immunotherapy. Today, I want to explain exactly how these drugs work, why this specific combination is effective for mesothelioma, what the treatment schedule looks like, what side effects to expect, and what outcomes research shows from this regimen. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I am not a physician, and this is not medical advice, but understanding your chemotherapy regimen helps you know what to expect and how to manage your treatment. So let's start with how Pemetrexed works. Pemetrexed is sold under the brand name Alimta. It's what's called an antifolate or antimetabolite chemotherapy drug. It interferes with folate metabolism, which are the biochemical pathway cells used to make DNA and RNA building blocks. Specifically, Pemetrexed inhibits 3 enzymes, and by blocking them, it prevents cells from making the nucleotides they need to build DNA. Without this functional DNA synthesis, cells can't divide, and cancer cells, which divide rapidly, are particularly vulnerable. When they try to divide without adequate DNA building blocks, they die. Pemetrexed affects both cancer cells and some normal rapidly dividing cells, which is why it causes side effects in bone marrow, the digestive tract, and other areas that have rapid cell turnover. Still, the goal is killing the cancer cells, which are more vulnerable than normal cells. Turning to cisplatin and carboplatin, these are platinum-based drugs that get combined with the Pemetrexed. Cisplatin and carboplatin work differently from Pemetrexed. They're platinum compounds that directly damage DNA. They create crosslinks in DNA strands, and the crosslinks act as chemical bonds, tying the DNA strands together so they can't separate and be copied. When cells with platinum-damaged DNA try to divide, the DNA can't be properly replicated and the cell dies. Cisplatin and carboplatin are similar drugs, but they're not identical. Cisplatin is the older, more potent drug, but it also has more severe side effects, specifically kidney damage, hearing loss, severe nausea, and peripheral neuropathy. Carboplatin is somewhat less potent, but it's also much better tolerated with fewer severe side effects. Now, before I go on, I'm going to take a break here and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end because I'm going to give you valuable information on where to find resources that will make a real difference for you. So why combine Pemetrexed with cisplatin or carboplatin? These drugs work through different mechanisms. Pemetrexed blocks DNA building block production, while platinum drugs damage DNA directly. Combining them attacks cancer cells on multiple fronts at the same time, making it harder for cancer to develop a resistance. The combination is what's known as synergistic. That means that the combination is more effective than either drug by itself. Some research has suggested that Pemetrexed actually makes cells more vulnerable to the platinum damage and vice versa. The landmark clinical trial that established Pemetrexed plus cisplatin as the standard treatment for mesothelioma was published back in 2003. This randomized trial compared cisplatin alone versus Pemetrexed plus cisplatin, with the results showing that the combination significantly improved median survival. Patients lived 12.1 months with the combination versus 9.3 months with cisplatin alone. The response rates, which represents the percentage of patients whose tumors shrank, were also better with the combination, 41% versus 17%. This trial established Pemetrexed plus cisplatin or carboplatin as the standard first-line chemotherapy for mesothelioma, and it has remained the standard for over 20 years, though today it's often combined with immunotherapy. What does the treatment schedule look like? Pemetrexed plus cisplatin or carboplatin is given intravenously every 3 weeks. This 3-week period is called a single cycle. On day 1 of each cycle, you go to the infusion center for treatment. The infusion takes several hours, typically 3 to 6 hours, depending on the drugs and the supportive medications you're given. Cisplatin requires extensive IV hydration before and after the drug to protect the kidneys, and this makes the infusion day take longer. Carboplatin doesn't require as much hydration, so its infusion days are somewhat shorter. You'll be given medications before and during chemotherapy to prevent nausea and vomiting. After day 1, you go home and recover. Days 2 through 21 are recovery days where you manage side effects at home. Then on day 22, which becomes day 1 of the next cycle, you return for the next treatment. Standard treatment is typically 4 to 6 cycles. After that, scans are done to assess your response. If the disease is responding or stable, treatment might continue. If the disease is progressing, treatment might be changed to a different regimen. It's important for patients receiving Pemetrexed to take supplements, including folic acid and vitamin B12. Without this supplementation, Pemetrexed causes severe and potentially life-threatening side effects. You'll take folic acid tablets daily, typically 400 to 1,000 micrograms. You'll receive vitamin B12 injections every 9 weeks, typically 1,000 micrograms intramuscularly. You start these supplements several days before your first Pemetrexed dose and continue throughout the treatment. Dexamethasone, which is a steroid, is also given before and after each Pemetrexed dose to reduce the risk of developing a skin rash. What side effects should you expect? For Pemetrexed, common side effects include fatigue, which is nearly universal and which worsens over the course of the treatment. Nausea and reduced appetite are common but are usually manageable with anti-nausea medications. Low blood counts are common, including anemia, which is low red blood cells, and that can cause fatigue and breathlessness. Neutropenia, which is low white blood cells, increases infection risk. And there's also thrombocytopenia, which is low platelets, which increases bleeding risk. There's also the previously mentioned skin rash, which can be reduced by taking folic acid, B12, and dexamethasone as prescribed. Mouth sores or mucositis appears in some patients, as does diarrhea or constipation. For cisplatin specifically, additional side effects include kidney damage, which is why patients need aggressive IV hydration and kidney function monitoring. Hearing loss and tinnitus can occur and can be permanent. Severe nausea can become a problem despite anti-nausea medications, and peripheral neuropathy, which is numbness, tingling, or pain in the hands and feet, and which can also be permanent. Patients can also experience electrolyte imbalances, with low magnesium and potassium being extremely common. Carboplatin causes many of the same side effects as cisplatin, but they're generally less severe. The main side effect caused by carboplatin is more severe thrombocytopenia or low platelets compared to cisplatin. But carboplatin causes less kidney damage, less nausea, less hearing loss, and less neuropathy than cisplatin. No matter which drug you take, blood counts are monitored before each cycle. If counts are too low, your chemotherapy schedule might be delayed or your doses reduced. What outcomes can you expect from Pemetrexed plus platinum chemotherapy? Based on multiple trials and real-world experience, median progression-free survival, which is the time until the disease starts to progress again, is about 5 to 7 months. The median overall survival is about 12 to 14 months. Response rates, which is the percentage of patients whose tumors shrink, are about 30 to 40%, with another 40 to 50% achieving stable disease where tumors don't shrink, but they don't grow. About 10 to 20% of patients see their disease progress despite the treatment. Of course, these are averages. Some patients have dramatic responses with their tumors shrinking substantially and remaining controlled for a year or more. Others have minimal or no response at all. Outcomes are generally better for patients diagnosed with the epithelioid cell type of mesothelioma than those who have the sarcomatoid cell type, and patients with good performance status tend to have better responses than those who are very debilitated. What about newer combinations? The Pemetrexed plus platinum backbone is now often combined with immunotherapy. The IND 227 trial led to approval of pembrolizumab plus Pemetrexed plus platinum chemotherapy. This combination showed better response rates, 62%, plus improved survival compared to chemotherapy alone. So the standard is evolving from Pemetrexed plus platinum alone to Pemetrexed plus platinum plus immunotherapy for many patients. If you can't tolerate cisplatin, carboplatin is substituted. While slightly less effective, it's much better tolerated and is an acceptable alternative for patients with kidney problems, hearing loss, or intolerance of cisplatin side effects. What happens if Pemetrexed plus platinum doesn't work? Second-line options include gemcitabine with or without platinum drugs, vinorelbine, immunotherapy, if not given first line, or clinical trials of novel agents. What questions should you ask about your chemotherapy? Start with asking whether you'll be receiving cisplatin or carboplatin and why that choice. How many cycles are planned? What supplements do you need to take? What side effects are most common with this regimen? How will you be monitored for side effects? What symptoms require immediate medical attention? Is immunotherapy being added to the chemotherapy? And what happens if this treatment doesn't work or causes intolerable side effects? To review, Pemetrexed plus cisplatin or carboplatin is the standard first-line mesothelioma chemotherapy treatment, and now it's frequently combined with immunotherapy. Pemetrexed blocks folate metabolism, which prevents DNA synthesis, while platinum drugs directly damage DNA. The combination has complementary mechanisms and is considered synergistic. This chemotherapy combination is generally given via IV every 3 weeks, typically for 4 to 6 cycles. Patients going through the regimen require folic acid, B12, and dexamethasone supplementation. Common side effects include fatigue, nausea, and low blood counts, and cisplatin can also cause kidney damage, hearing loss, and neuropathy. Carboplatin is generally better tolerated but has a higher risk of thrombocytopenia. The median survival for patients treated with this combination is 12 to 14 months with a 30 to 40% response rate. Carboplatin is generally substituted in if cisplatin isn't tolerated. For more information on mesothelioma chemotherapy and treatments, visit mesothelioma.net or call 1-800-692-8608 or use the live chat feature to speak to one of our patient advocates right away. As for me, remember to post questions below, and I'll see you next time.